about your symptoms and your life before the surgery.
I had a hard time walking any distances. I couldn't, even just standing up, sitting down in a chair. I wasn't able to pick up my daughter for over a year.
Oh my, for over a year.
Yeah.
Now, 1 to 10, how bad was the pain?
On bad days, it was up to 8 to 9.
Okay.
Yeah. I would say a good day was 4 or 5.
Okay.
And that was a very good day.
Okay. How far could you walk?
Maybe a half a block.
Where was the pain? Explain to me where the pain was.
Low back, both sides, kind of just radiated right in there. No
And
matter
then
what I did.
And going down to your legs?
Yep.
Tell me about where
It
was
would come across the front,
Mm-hmm.
mostly on the left side, and then I would get it down almost to my ankle.
To the ankle, okay.
Yep.
That is L4 and L5.
Mm-hmm.
And about actually, when was the surgery?
June 17th.
So about just about 3-4 months ago.
Mm-hmm.
And this is what we did. We fused your L3, 4, 4, 5, and here are the screws.
Mm-hmm.
It's just 3-4 months ago we did the surgery. The screws are exactly where they need to be. Look at that. I use big screws, and using our technique with 2 C-arms, I'm able to put it dead center through the pedicle, and bigger screw always are better, obviously, for this purpose. And I see that the bone is growing. Here it is. If you look carefully, the bone is growing inside of the screw that we put in, the spacer we put in, and outside. So after 3-4 months, look at that. We have a solid fusion in the bone here. But how do you feel? How are you?
Wonderful.
Excellent.
It is a night and day difference.
Okay. Well,
I would never ever hesitate having it done.
Okay. No, but we had a rocky road to get there, right?
Yes.
Tell me about that.
We had lots of problems with my SI joints first.
Yeah, well, when we do surgery for the lumbar spine, sometimes a side joint complains. As a matter of fact, we know if you have a spinal fusion, 43% of the time, the sacroiliac joint will complain.
Okay.
And we had some problem with that. Is that better?
Yes.
Okay.
Yep. Left side still bothers me a little bit, but very, very rarely.
And we see as well here that, there is some what we call vacuum or air affecting your sacroiliac joint. And that sort of makes sense that gives you some symptoms, as you see here and here. They are not in the best shape to start with, but that is already getting better.
Oh, yes.
Good.
Yes.
What the other problem did we have? We had some problem with the leg, right? And the left leg?
Yep. I lost feeling for the most part from about my hip to my ankle. And it took about 2 weeks. And
for that to come back.
Yep. Now I've got, I would say, 98% feeling.
Yeah. How far can you walk now?
I can push about 2 to 3 blocks before, and then my SI joint starts to flare up a little, but nothing it's amazing.
So back pain, how bad is the back pain?
None.
And the leg pain?
I would say it's at a 1 to 2 maybe.
Excellent, and that's only 3.5 months after the surgery. So this is very good result, and the bone even is growing. So and you asked me a question that made me very happy.
I asked if I could ever jump on a trampoline with my daughter.
And the reason that question made me happy is because after open old-fashioned surgery, which I have done thousands of those surgery, the question that my patients are asking me, doctor, when can I sleep again in my bed? Or when can I wipe my buttock? When can I take care of my basic needs? You passed those long ago.
Yeah, I can handle all that.
But your question is now, when can you jump on trampoline? That means emotionally and bodily you feel you're getting that direction.
Oh,
and that makes me very happy.
Yes.
And obviously this kind of fusion, you got only the minimal invasive fusion, but I have done both ways, and you are so far ahead of the curve comparing to how old-fashioned surgery would have been. And I think in a way as well you feel that the things are hopefully with time as they are going on becoming easier and easier.
Oh yes, yep.
These kind of things that things that are becoming easier and easier after old-fashioned surgery start happening about 6 to 12 months after the surgery most of the time.
Oh wow.
Yeah, but with our patient it happens within a month to this level that people feel normal, like a normal person again.
I would say within hours of waking up after surgery, I could tell the difference. I mean, it was amazing.
Well, thank you so much for the interview. I appreciate that. Any other comment, anything, like a question for me that I can answer? Because if you have a question, probably 5 other people have the same question.
No, all I was wondering about is my restrictions.
Yeah,
so.
and the restriction is a gradual increase in the restriction.
Mm-hmm.
I tell all my patients, your body is your friend, not your enemy. Just
Mm-hmm.
give it a little more to do and then see how it's behaving.
Mm-hmm.
Okay? Well, thank you so much. I appreciate that.